Regional private hospitals provide vital care.
We had a really smooth, amazing birth and we were really well supported.
On discharge that has lots of helpful websites and phone numbers you can contact 24/7 and things like that.
First-time parents Sarah and Jeremy Soon say having their baby Sadie at St John of God Hospital in Bendigo gave them more choice.
Being able to stay for a few more days, really get settled, and just some continuity of care as well.
Jeremy and Sarah are lucky. Their hospital was on the brink of shutting down its maternity unit last year.
We were very close to having to close it. We saw what was happening in the rest of the private hospital sector. There were multiple private maternity services that were closed or had been closed.
In the past year, 21 private hospitals have opened across Australia and 16 have closed, according to the Federal Department of Health. Sunshine Private in Melbourne is one of them. Its operators pulled the pin just 14 months after the new site opened, blaming funding issues. The crisis in private health is threatening the entire health system, and the federal government has ordered an urgent review.
We want a full health check of the private hospital sector. It plays a really important part in the broader healthcare system. It delivers about 2/3 of all elective surgery. It's an important player for maternity services, for mental health, a range of other different types of service.
We have unprecedented waiting lists for elective surgery in our public hospitals. So any failures in the private hospital system will throw pressure back on the public hospital system that could cause collapse.
The latest figures show almost half of all Australians have private hospital cover. Medibank and Bupa hold about 52% of the private health insurance market.
Private health insurance participation has been growing quite strongly since the beginning of the pandemic, in spite of people's concerns about the cost.
There are 650 private hospitals across the country. The peak bodies for those hospitals echo St John of God Bendigo CEO Michael Hogan's concerns that the cost of treating patients has soared.
Particularly by inflation, particularly by cost increases in wages, medical surgical supplies, energy, insurance. All of these costs have increased significantly post-COVID, and at this point the funding provided by health funds hasn't kept up with that.
4 of the 5 big funds hiked premiums more than the average 3% that was set by the federal government this year.
The gap has grown, and it's grown because the cost of delivering services has increased at a greater rate to the funding that's provided by health funds.
Look, more money will not fix the issues that the sector is experiencing, but I just want to be clear that the private health funds have paid an additional 9.7% to the hospitals over the last year. So the issue is not that the health funds are not providing them with money.
Catholic Health Australia has crunched the numbers. In 2017, operating profits for health insurers and private hospitals were relatively equal. In 2023, the operating profits of health insurers soared to 90%, while private hospitals had shrunk to 10%. Dr. Rachel David is CEO of the peak body for private insurers.
We are not going to be paying a large increment to hospitals across the board and without discrimination, because that will put up premiums for our members, that will result in additional people dropping out of the system as a result of the cost, and that won't help hospitals at all.
Private insurers say hospitals need to be more efficient and that the cost specialists charge should be better monitored.
We've noticed a really sharp increase in out-of-pocket costs since the pandemic occurred, and what we think is happening is that some groups of medical specialists are reducing their hours and putting up their out-of-pocket costs to compensate for that. This is a really difficult problem for us to fix because we can't keep chasing higher and higher and higher out-of-pockets with higher rebates.
I can only speak for our setting here in Bendigo, and in a regional setting I think the level of out-of-pockets that are charged by doctors is quite low. In an area like maternity, where traditionally the out-of-pockets have been higher, they're still very low compared to a metropolitan area.
Increasingly, private insurers are offering members surgery options with minimal out-of-pocket fees, typically at certain hospitals with certain doctors.
We've now got 35 hospitals, more than 200 medical specialists, and thousands of patients have gone through the program and had a great experience as a result.
4 months ago, Victoria Pedrosa Hart needed a knee replacement and opted for a surgeon who worked at the East Sydney Private Hospital, which is 49% owned by Medibank.
I was introduced to no-gap surgery by the doctor, and he worked with Medibank Private. The surgeon explained that that's what I could have had, and I made a decision to go ahead with it because I would save a lot of money. I had a short stay at hospital, and then I had the physiotherapist coming to my home, and that was also covered.
Medibank is now also buying into GP clinics, and the Australian Medical Association is concerned about how this might impact on the quality of care.
One of the problems with vertical integration, where the private health insurer owns the GP practice, has contracts with the surgeons who are providing care, owns part of hospitals, is that there's an intrusion into that doctor-patient relationship, so that no longer are doctors working with patients to come up with the best care for that patient, but they're following a set of financial rules designed to increase the profit of private health insurers.
Medibank's Chief Medical Officer rejects this.
There is no doubt that when you provide a program with a shorter length of stay in an acute hospital, and certainly providing care in the home, can be cheaper, but it's important to note that that saving is really the saving that actually leads to the removal of those out-of-pocket costs for consumers. And that's really the big driver for us.
They won't have a health insurance product to sell if they don't have private hospitals to provide the service.
While private insurers and hospitals may have different views about how to fix the sector, both agree there's an urgent need for reform.
We need a viable private health insurance industry, and we need a strong, viable private hospital operation. That's critical for each of them, but more importantly, it's critical for patients and for the viability of our public hospital system as well.
The findings of the federal review into private health are due later this month.